I am Dr. Ramnarayan. I am a functional neurosurgeon. Functional neurosurgery means dealing with the problems due to functions of the brain, the spinal cord and other nervous systems by surgical methods. I am sure all of us have faced a situation when we are in a meeting or we are in a temple or things like that, but we feel the urge to pass urine. We cannot, but for a few minutes there is a lot of discomfort in our abdomen. But imagine a patient who cannot pass his urine whenever he wants to, or imagine another patient who passes urine continuously. These are two conditions, one which is called incontinence, where the patient passes urine continuously without any control, or second is called retention, where the patient cannot pass urine when he wants. This causes multiple problems like frequent infections, and even most of the patients end up as chronic renal failure patients, as the kidneys get damaged over a period of time. So these are very depressing conditions, and then socially also it's a big problem. So imagine a person who is continuously passing urine, nobody will want to go near him. He will have problems in having social acceptability. He cannot go for a job because people will refuse to sit near him because he is always has the stench of urine with him, like that. Sacral nerves are the nerves which control the urine. In fact, sacral nerves are of 5: S1, S2, S3, S4 and S5. Out of this, S2, S3 and S4 control both the bowel and the bladder. That is, they control the urine system as well as the motion system. So whenever there is a problem with the S2, S3, S4, or whenever there is a problem of control of these nerves, you have problems with controlling the urine and the motion. It is in these patients that we offer this sacral nerve stimulation. That is, we stimulate the S3 using an electrode which is put in their back, and we give them a battery in the front in the lower abdomen, and using the battery the patient can control his urine or motion just like any one of us. We actually train the patient to use the battery, or with a computer mouse like system. He can use the control the battery and control the urine just like any one of us. Just like all my other procedures, whenever a patient comes to me, I always do a trial procedure to see whether the patient will benefit from the surgery. So as I said earlier, the patients who will benefit from this surgery include patients who have incontinence, that is, people who are not able to control their urine, they are passing urine continuously without any control, or patients who have retention, that is, they are not able to pass the urine when they want, that is, the urine is retained inside the urinary bladder and does not come out when the patient wants. There is also another condition called fecal incontinence, where the motion goes continuously without control. Of course, constipation is a big problem, probably one of the biggest discomforting problems in the whole world. And then other conditions like chronic pelvic pain in women, so many other conditions like that where it causes severe pain. So all these conditions can be treated with the sacral nerve stimulation. We stimulate the S3, as I said earlier, because it is S2, S3, S4, so S3 is a central nerve, and so we stimulate it. And during the trial we notice some changes in the system which will help us to find out whether the nerves are normal, the connections are normal, and whether the patient will benefit from the surgery. We also use many other parameters like voiding, diaries and all that, which I am not going into the technical details of this. Before the surgery, we always send the patient to the urologist or a gastroenterologist for some investigation. For example, a patient with urinary retention, they do a lot of investigations including manometries and dynamic studies, uroflowmetries, dynamic studies and all that, which will tell us whether the patient has got a neurological problem or not. Sacral nerve stimulation is internationally approved surgery. It was actually approved by the FDA, that the Food and Drug Administration, in 1997. And it is approved also by all the Indian agencies, and the results of the surgeries are very good. In fact, I have many examples where patients who were unable to control their urine for a long time, ending up having early stage renal disease, that is, their blood serum creatinine started increasing, and then after the surgery, after they were able to control their urine, the creatinine dropped back to near normal levels, showing that the kidney was recovering. Sacral nerve surgery is a very good surgery provided it is done in the selected patients.